Good morning, Nurse.org fam. It is super early. I get up at 7 a.m. To start my day. I've already gotten ready, but I'm going to go downstairs, get my kids ready, drop them off at school, and then we're going to start our day. I'm so excited for today. I'm so excited to show you the long-term care world and the psych world all in one. Get ready for some fun. See you soon. So balance is definitely everything. This is Jace. His dad's going to take him to school, and I'm going to take my other son, Jaden, to school, and then we'll start our day. Say good morning, Jace. Say good morning. Okay, so preparation is definitely key. What I do is I go into long-term care facilities and provide their psych care. I make medication recommendations, I do referrals. So before I go into these facilities, I definitely make a list of the patients that I'm going to see, that I do for follow-up, or any new patients that I have. These are generated based off patients that were referred to our company for services. The company I work for, we work as kind of like consultants for these facilities to provide their psych care. Psych is definitely a specialty. Usually when it's a specialty service, the patients either go out into the community or the providers can come in. Providers that come in are usually psych, as myself. Medical nurse practitioners come into the facility. Podiatrists usually come into the facility. So we provide care at the patient's pretty much home to make it easier for them and for the facilities to. So when I make a list of my patients for the day, I usually review their charts. I do this the night before or sometimes a couple days before, just so I can be ready for the day. I look at their most recent vital signs. I look at their medication list to see if anything changed. I also look at any notes from the provider. So sometimes nurses or social workers put in notes about certain behaviors. I review all these things so that the day of, I'm ready to take care of the patient. Again, this can be done the night before, a couple days before, or sometimes the morning of. I'm just OCD, so I like to do it a couple days before. Today, we're going to two facilities. One will be a nursing home, traditional nursing and rehab, meaning that the patients are there long term. They're getting care from nursing, also CNAs. Some of them are receiving therapy services based off their insurance and their need. So then after that, we'll go to an assisted living. An assisted living is a little bit different. Little less service. So usually the patients have to have some level of independence. This assisted living is a little different though. They have a memory care unit, and I provide services on that memory care unit, and those patients can get a little extra care. The difference between nursing home and assisted living: nursing home is usually covered by insurance, such as like Medicare or Medicaid, and then for assisted living, it's out of pocket. Insurance does not cover assisted living. You can pay for it directly out of pocket, or you can use long-term care insurance, which you can usually start paying for it when you're about 50 years old, and that insurance will cover your long-term care stay. So those are the two types of facilities we'll see today. I'm very excited to show you some of the things I do, some of the interactions I have, some of the behaviors I manage. It's going to be fun. Last but not least, before we go, I just want to show you, this is a manual I kind of take with me. I work with the geriatric population. This manual just gives you like insight on medications and how to manage certain behaviors. It's very, 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 very good. I got it off Amazon. And what I do with this manual is I use it to kind of make sure that I'm prescribing appropriate doses. I do have basic psychopharmacology manuals, but the elderly considerations in those manuals usually aren't as in-depth as they are in this one. So this is why I do like this one, because it gives me a better understanding of prescribing in this particular population. This is something I carry with me. It just helps me. So I'm going to pack my bag and we'll be on our way. I have my iPad, my notepad in here of the patients we're going to see, and then I'm going to put my manual in. So I've arrived at my facility. I do want to just show you the actual facility. And we always have to keep in mind when we work in long-term care that this is in their home. So I treat it as such. Before I go in, I'm just going to put on my mask, my goggles, get my bag. And then when I get in there, I'm going to check in with social workers, nurses, just before I start seeing patients. Let's go. Okay. So I'm done with my first facility. Didn't get to show you all as much as I wanted to and I'm trying to stay compliant and stay on track. So I did get to meet with the social worker and the director of nursing on the patients that I saw today. I usually just check in and ask if there's any changes to the patient's behavior. I then go see the patient, check in, and then I review the medications. So I came in at, I think we came in around 9:30, and we're leaving. I usually see my patients and I go home and I document just because it's easier for me, and I'm a guest and I don't want to take up space in the facility. So what you'll see me do now, we're going to drive to our next facility. We'll see those patients and then we'll document when we get home. And that's the joy of long-term care. I love it. It's flexible. You come and go as you please. I work off productivity, so there's no hours. So if you're looking at long-term care, those are some perks. Okay, we're at our second facility. I just want to show you assisted living facility. This is the memory care side. It's pretty big. It's a full property, and there's different areas. Then there's assisted, and this is the memory care side. So hopefully I get to show you a little bit more interaction. Of course, can't show you any patients, but we're starting our day here. This is our second facility of the day. So now that I've seen my patients, I found me a little quiet room. I'm going to go ahead and document most of these because this facility is a little small. What I'm documenting is my assessment for today, usually a mental status exam. So saying like how they presented, their appearance, just looking at like basic mental status updates on the patient, also documenting what the staff told me about the patients. And then I put in my recommendations for medications. So that usually looks like either continuing their current regimen. I may increase some things, decrease some things. A big thing with long-term care is you want to make sure that they're on the lowest effective dose of psychotropic medications, if any at all. So I try to look through their charts, make sure they're on the appropriate things, make sure the dosages are correct, and see if there's any room for what's called a gradual dose reduction, where we're reducing those medications. So as I was saying, after we do a gradual dose reduction, we will assess the patient again and say, hey, that worked for the patient, or no, their symptoms returned. So either their depression, their anxiety, their behaviors, sleep troubles returned after we tried to decrease it. So this dose is effective. But we have to do that in the elderly population every quarter or every year, depending on the medication, just to make sure that we don't have them on dosages that are inappropriate. Because as we know, as you get older, your kidney function and your liver function go down. So you don't require the same dosages of the medications to get the same effects. So anytime you're working with the elderly, rule, just a basic rule, go low and slow. I always start at the lowest doses and then I go up gradually in a very, very, very restrictive way to make sure I'm not causing any harm. Over medicating in this population can cause things like falls, confusion. So I don't want to do anything to the patient that's going to hurt them in the long run. Hey guys, leaving another facility. Went well, saw the patients, checked out with the Director of Health Services. Now we're headed home to document. So I just wanted to share some things about why I chose long-term care. So I've always had a passion for the geriatric community. Just working with that community has been my thing. Just like some people like pediatrics, I love geriatrics. I love just meeting them in that time of life. That's that golden time. They have all their wisdom and stories to share. I'm just very, very, very passionate about that population. Long-term care as an NP is also a setting that's very flexible. You usually are kind of like a one-of-one in the facility, so you kind of make your own schedule. You're there based off your productivity and not necessarily your hours. So that's something I also really enjoy about long-term care. And it was very attractive to me when I was doing my clinical rotations, where I got to choose different settings to see where I really wanted to be and fit in the primary care setting. So we are finally home. I'm coming to my little office area to start my documentation. I'm going to document all my patients that I saw today. So documentation in long-term care. I try to lock my notes as soon as possible. Per Medicare, though, we have 7 days to lock our notes as nurse practitioners. I try not to get that far behind. But after those 7 days, we can no longer bill for the visit. Each patient I saw today has a time code, and those codes are used to determine how much I'm reimbursed for the visit. So I use those codes. I lock my notes timely, and follow all the documentation steps so that I can get reimbursed for the visit. So I saw about 17 patients today. So from those 17 patients, it takes me about maybe 2 hours, 3 hours to kind of document and get everything together, depending on whether it was a follow-up or initial visit. I only had one initial visit today. Those notes usually take a little longer, but the reason it's so quick is because I prep my charts before time. So I also wanted to share a question that I get a lot. Will I find a job if I choose a role in adult gerontology or another specialty? A lot of people go the FNP route thinking, oh, well, I have a broader knowledge and I'll be able to get more jobs and it won't minimize my possibilities. I don't think that's true. I definitely think it's a good idea to look at jobs in your area. Nurse.org is a really good resource to use when you're looking at kind of just like information about state by state statistics. Also learning a little bit more about the different certifications that are offered. Again, I did my certification in adult gerontology primary care. I was able to find a job fairly quickly. I think it's hard with any specialty, but fairly quickly, I would say. And I've been in this role for a while. So don't discourage yourself based off what you think. Always do the research and choose your specialty based off what you're passionate about. Okay, guys, so the day is done. I'm done documenting. I'm going to spend some time with the kids and relax for the rest of the evening. I truly enjoyed taking over. For more resources on being an MP, new grad stuff, nursing stuff, check out Nurse.org. Full of information. I love the site. I pull most of my content from there to kind of express it in a creative way, but more on NP schooling, just salaries, great states to practice. I love Nurse.org. So I appreciate you all joining me today. I hope you enjoyed yourself too. For all my Jerry Psych MPs out there, what's up? Thank you. Have a good one.